If you're relying on medication to manage chronic headaches or migraines, chances are you've come across Butalbital. But what exactly is it, and what are its benefits and side effects? Unlocking the secrets of this widely prescribed medication is the aim of our comprehensive guide. What is Butalbital and its uses? Butalbital is a barbiturate drug that is commonly used in the treatment of tension headaches and migraines. It belongs to a class of medications called sedative-hypnotics, which work by relaxing the muscles and reducing anxiety. Butalbital is often combined with other medications, such as acetaminophen and caffeine, to enhance its effectiveness. The primary use of Butalbital is to provide relief from the symptoms of tension headaches. These headaches are often described as a constant, dull ache that can be accompanied by muscle tension in the neck and shoulders. Butalbital helps to relax the muscles and alleviate the pain associated with tension headaches. Butalbital is also sometimes prescribed for the treatment of migraines. Migraines are severe headaches that are often accompanied by other symptoms, such as nausea, vomiting, and sensitivity to light and sound. While the exact mechanism of action for Butalbital in treating migraines is not fully understood, it is believed to help by reducing the intensity of pain and promoting relaxation. Butalbital is available in different formulations, including combination drugs like Fioricet and Fiorinol. These medications combine Butalbital with other ingredients, such as acetaminophen, caffeine, and codeine. The specific combination and dosage will depend on the severity of the headache and the individual's response to treatment. Butalbital should only be used as directed by a healthcare professional and should not be used for prolonged periods or in high doses, as it can lead to dependence and addiction. It is important to follow the prescribed dosage and duration of treatment to minimize the risk of adverse effects. Benefits of using Butalbital. One of the primary benefits of using Butalbital for headache relief is its ability to provide fast and effective relief. Many individuals who suffer from chronic headaches find that Butalbital can help alleviate their symptoms and improve their quality of life. The relaxation and sedative effects of Butalbital can help reduce muscle tension and promote a sense of calm, making it easier to manage the pain associated with headaches. Another benefit of Butalbital is its ability to enhance the effectiveness of other pain relievers, such as acetaminophen. When combined with other medications, Butalbital can provide a synergistic effect, resulting in greater pain relief. This can be particularly beneficial for individuals who have not responded well to other treatments or who have severe or frequent headaches. Butalbital is also known for its sedative properties, which can be helpful for individuals who struggle with anxiety or have difficulty relaxing. By promoting relaxation and reducing anxiety, Butalbital can help individuals manage the stress and tension that can contribute to the onset and severity of headaches. It is important to note that while Butalbital can provide effective relief for headaches, it is not a cure. It is intended for short-term use to manage acute episodes of pain and should not be used as a long-term solution. Chronic use of Butalbital can lead to dependence and addiction, as well as an increased risk of side effects. Side effects of Butalbital. Like any medication, Butalbital can cause side effects in some individuals. Common side effects include drowsiness, dizziness, lightheadedness, and sedation. These side effects are more likely to occur when starting Butalbital or when the dosage is increased. It is important to avoid activities that require alertness, such as driving or operating machinery, until you know how Butalbital affects you. Other potential side effects of Butalbital include nausea, vomiting, stomach upset, and constipation. These side effects are generally mild and resolve on their own. If they persist or become bothersome, it is important to speak with a healthcare professional for further guidance. In rare cases, Butalbital can cause more serious side effects, such as allergic reactions, difficulty breathing, and liver problems. If you experience any unusual or severe symptoms while taking Butalbital, it is important to seek immediate medical attention. It is worth noting that Butalbital can interact with other medications and substances, which can increase the risk of side effects or reduce the effectiveness of the medication. It is important to inform your healthcare provider of all the medications you are taking, including over-the-counter drugs and herbal supplements, to ensure safe and effective use of Butalbital. Precautions and warnings when using Butalbital. Before taking Butalbital, it is important to discuss your medical history and any underlying conditions with your healthcare provider. Certain conditions, such as liver disease, kidney disease, respiratory disorders, and a history of substance abuse, may affect the safety and effectiveness of Butalbital. Your healthcare provider will be able to determine if Butalbital is suitable for you and may adjust the dosage or recommend alternative treatments if necessary. It is also important to be aware of the potential for dependence and addiction with Butalbital. Butalbital is a habit-forming medication and should not be used for prolonged periods or in high doses. If you find that you are relying on butalbital more frequently or in higher doses than prescribed, it is important to seek help from a healthcare professional. Butalbital should not be abruptly discontinued, as it can cause withdrawal symptoms. If you wish to stop using butalbital, it is important to work with your healthcare provider to gradually reduce the dosage and monitor for any withdrawal symptoms. Interactions with other drugs and substances. Butalbital can interact with other medications and substances, which can increase the risk of side effects or reduce the effectiveness of the medication. It is important to inform your healthcare provider of all the medications you are taking, including over-the-counter drugs and herbal supplements, to ensure safe and effective use of butalbital. Certain medications, such as sedatives, tranquilizers, and opioids, can enhance the sedative effects of butalbital and increase the risk of respiratory depression. Combining butalbital with alcohol or other substances that depress the central nervous system can also increase the risk of sedation and respiratory depression. Conversely, certain medications, such as anticonvulsants and some antidepressants, can reduce the effectiveness of butalbital. It is important to discuss all medications you are taking with your healthcare provider to ensure that there are no potential interactions. How to take butalbital safely. To take butalbital safely, it is important to follow the prescribed dosage and duration of treatment. Butalbital is typically taken every 4 to 6 hours as needed for pain relief. It can be taken with or without food, but taking it with food may help reduce stomach upset. Do not exceed the recommended dosage or take butalbital more frequently than prescribed. Doing so can increase the risk of side effects and dependence. If your symptoms do not improve or worsen after taking butalbital, it is important to consult your healthcare provider for further evaluation. If you miss a dose of butalbital, take it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and resume your regular dosing schedule. Do not double the dose to catch up. Alternatives to butalbital for pain relief. While butalbital can be effective for headache relief, there are alternative treatments available for individuals who prefer to avoid or cannot tolerate butalbital. Some common alternatives include over-the-counter pain relievers. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen sodium, can be effective for relieving mild to moderate headaches. These medications work by reducing inflammation and pain. Triptans. Triptans are a class of medications specifically designed for the treatment of migraines. They work by constricting blood vessels in the brain and blocking pain signals. Triptans are available in different formulations, including tablets, nasal sprays, and injections. Preventive medications. For individuals who experience frequent or severe headaches, preventive medications may be prescribed. These medications are taken on a regular basis to reduce the frequency and intensity of headaches. Common preventive medications include beta blockers, anticonvulsants, and antidepressants. Lifestyle modifications. Making certain lifestyle changes can also help reduce the frequency and intensity of headaches. These may include getting regular exercise, practicing stress management techniques, maintaining a regular sleep schedule, and avoiding triggers such as certain foods or environmental factors. It is important to discuss alternative treatments with a healthcare professional to determine the most appropriate option for your specific needs and medical history. Common misconceptions about butalbital. There are several common misconceptions about butalbital that are important to address. Butalbital is not a cure. While butalbital can provide effective relief for headaches, it is not a cure for the underlying condition. It is intended for short-term use to manage acute episodes of pain. Butalbital should not be used long-term. Prolonged use of butalbital can lead to dependence and addiction. It is important to follow the prescribed duration of treatment and work with a healthcare professional to determine the most appropriate treatment plan. Butalbital is not suitable for everyone. Butalbital may not be suitable for individuals with certain medical conditions or a history of substance abuse. It is important to discuss your medical history with a healthcare professional to determine if butalbital is safe and appropriate for you. Butalbital should not be abruptly discontinued. Abruptly discontinuing butalbital can cause withdrawal symptoms. If you wish to stop using butalbital, it is important to work with your healthcare provider to gradually reduce the dosage and monitor for any withdrawal symptoms. Butalbital addiction and withdrawal symptoms. As mentioned earlier, butalbital is a habit-forming medication that can lead to dependence and addiction. If you find that you are relying on butalbital more frequently or in higher doses than prescribed, it is important to seek help from a healthcare professional. Abruptly discontinuing Butalbital can cause withdrawal symptoms, which may include anxiety, restlessness, tremors, muscle aches, insomnia, and nausea. It is important to work with your healthcare provider to gradually reduce the dosage and monitor for any withdrawal symptoms during the tapering process. If you or someone you know is struggling with Butalbital addiction, it is important to seek help from a healthcare professional or addiction specialist. They can provide guidance and support to help you overcome your addiction and develop healthier coping mechanisms for managing pain and stress. Conclusion and final thoughts. Butalbital can be an effective medication for managing chronic headaches and migraines. It provides fast and effective relief by relaxing the muscles and reducing anxiety. However, it is important to use Butalbital safely and responsibly to minimize the risk of side effects and dependence. By understanding the benefits and potential drawbacks of Butalbital, individuals can make informed decisions about its use and explore alternative treatments if necessary. It is important to work closely with a healthcare professional to develop a personalized treatment plan that addresses your specific needs and medical history. Remember, Butalbital is not a cure for headaches. It is a tool that can provide temporary relief, but long-term management may require lifestyle modifications, preventive medications, and other therapies. By taking a comprehensive approach to headache management, individuals can improve their quality of life and reduce the impact of chronic headaches. Thanks for watching.